Hello and welcome to the S&P Senior Medicare Patrol podcast, Sip and Learn with S&P. I'm Janetta with Senior Medicare Patrol. I am the Complex Interaction Specialist for Georgia, Louisiana, and Mississippi. So today we're going to talk about genetic testing. And as always, we'll give you a little bit of information about the S&P program and about how to contact us.
And I'm Danae. I'm the Community Outreach Specialist for Mississippi. Before we get started, I do need to let you know that this project is supported by the Administration for Community Living, U.S. Department of Health and Human Services, as a part of a financial assistance program, award with 100% funding by ACL HHS. The contents are those of the author and not necessarily representative of the official views, nor an endorsement by ACL or HHS or the U.S. government. So let's get started. Janetta, what is genetic testing and what is genetic testing frauds and scams?
Okay, so let's start with what is genetic testing. The Center for Disease Control describes genetic testing as a series of different tests that can provide information about various genetic disorders or your potential risk to develop certain types of cancers. So there are several different kinds of genetic tests, and they are done by using a cheek swab, a blood sample, or it could be a saliva sample. Genetic testing fraud happens when scammers are offering these tests for free to Medicare beneficiaries, and I said free in quotes. They then bill Medicare for these tests that are not medically necessary. And in most cases, the beneficiary or their personal physician may never receive results. The genetic test should only be ordered by your healthcare professional when it's deemed necessary. These testing scams are currently a widespread issue throughout the country. The scammers are able to do this by obtaining the beneficiary's Medicare information. Okay, so Danae, tell us, what types of screenings are offered? Give us an example of how this scam kind of works.
Well, Janetta, these genetic testing scams go by many different names. It could be called cancer screening, cancer test, DNA screening, hereditary cancer testing or screening. It could also be called Parkinson's screening test or dementia screening test. These are some of those, just some examples. The biggest one I've seen is the allergy testing. These are just a few examples of what they're calling these tests. And so an example of genetic testing fraud would be when a company is providing a test or screening when you never requested it. Another example would be a company billing for Medicare or screening services that are not covered by Medicare. Lastly, a company requesting your Medicare number at a community event or local health fair should never happen. Scammers may come to your local senior center, senior apartment complex, or health fair event that you're attending. They may ask you questions about your family or personal health care information, such as, has anyone in your family had cancer? Or they may also ask you, have you ever had cancer? They will then offer to perform a genetic test, and they will claim that this test will tell you your chances of developing cancer. You can report genetic testing by calling S&P at our toll-free number, and that is 1-877-272-8720. The office hours are Monday through Friday, 8:30 to 5 on Central Standard Time, or you can contact us on our website at www.stopmedicarefraud.org. So, Janetta, what happens if Medicare denies genetic testing claims?
Well, that's a great question. If Medicare denies the claim, you could be responsible for that bill for the entire cost. Remember, these types of tests should only be ordered by your personal healthcare provider, the person who is familiar with your specific situation, not some random person that you don't know or some random physician that you've never met. If you have questions about genetic testing or billing questions, you can call Senior Medicare Patrol at 877-272-8720, Monday through Friday, 8:30 to 5 Central Time. Or you can contact us on our website, www.stopmedicarefraud.org. We also want to remind you that that our program covers Georgia, Louisiana, and Mississippi. And the number we've given you is for those three states. However, the S&P program is active in all 50 states and in the U.S. territories. So if you're living in a different state, don't worry. S&P is the S&P program is in your state. And the way to find out what number to call for your state, you can call the S&P Resource Center. So that number for the S&P Resource Center is 877-808-2468. You can call them and ask them to give you the number to your state's S&P program. Or you can go to their website, and that website is smpresource.org. And there they can connect you through to the national S&P hotline to your state's S&P program. So don't worry if you don't live in Georgia, Louisiana, or Mississippi, you still have an S&P program in your area. We all do the same thing. We're all trying to fight healthcare fraud and Medicare scams. So by reaching out to them, you can get the help that you need. So please reach out and contact them if you have any need or any questions about the things that we're discussing on this podcast today. So Danae, what is a genetic, what does a genetic test cover? What is covered under genetic tests?
There are times when genetic testing may be covered. Genetic testing is covered when someone has stage 3 or stage 4 cancer. Also, when the test is medically reasonable or necessary. Of course, when it is ordered by a treating physician or your treating doctor, that would be appropriate. When one or more coverage requirements are met for colorectal cancer, genetic screening would also be covered at that point. And lastly, when a treating physician orders the test as a diagnostic service and uses the results to manage that person's condition, that would be appropriate. And so that's when it would be covered. There's also no other Medicare coverage for genetic testing as a screening service. That's something important to be aware of.
Okay.
So, Janetta, what can you do to stop genetic testing fraud?
Okay, so the best way to avoid becoming a victim of genetic testing fraud and scams is to be sure that your doctor has assessed your health condition. Do not give out your personal information or accept any screenings from someone at a community event. It could be at a local fair, a local health fair, a farmer's market, or any community event or any type of event. Then we want you to review your Medicare summary notice or the explanation of benefits. This is going to be the best way to make certain that no one is using your Medicare number or committing Medicare fraud with your Medicare number. If you see any suspicious items on the Medicare summary notice or the explanation of benefits, you should report it. And you can do that by calling our toll-free number, which is 877-272-8720. 8720, Monday through Friday, 8:30 to 5 Central Time. It's very important that you care about what's going on with your Medicare benefits. We want these benefits to be around for us for a long time. So always read your Medicare summary notice and the explanation of benefits. Look for words like gene analysis, molecular pathology, or laboratory. When these words are being used, it could be an indication that genetic testing has occurred. Okay, Danae, so tell us and describe to us, what are the keys to preventing Medicare fraud? What are our three keys?
These are very, very important to remember. So we think about prevent, detect, and report. So we'll start with preventing. Preventing is going to involve you treating your Medicare and Social Security numbers like a debit or credit card. Do not carry them with you unless you truly need them. Don't provide your Medicare number to individuals that are not authorized Medicare professionals. Remember, Medicare won't call you and ask you for your Medicare number. Secondly, detect. How do we detect these things? So, number one, keep track of your visits to the doctor or clinics or hospitals or pharmacies. Compare them to your MSN, that's your Medicare Summary Notice, or your EOB, which is your explanation of benefits. Review your information for potential errors, frauds, and abuse. Also, these will include double billing, charges for services that were not received, and or services not ordered by your doctor. Always remember, if your doctor ordered it, then it's valid. If they didn't, it's something to question. Lastly, report. If you suspect that something that you're at risk, something's not right, you may be a victim of Medicare fraud. Report it immediately. Contact your S&P for assistance with Medicare scams, waste or abuse, and also reporting any possible errors or fraud helps you to save your benefits and protects others from becoming a victim. Again, you can reach out to us on our website at www.stopmedicarefraud.org, on social media, Facebook, that is. Okay, that is an interview for genetic testing on how to protect yourself.
Okay. Thank you guys so much for tuning in to this episode. We want you to come back to our next episode, and thank you for joining us.
Thank you.
All right. Bye-bye.
Bye-bye.